The term flatten the curve comes from a 2007 paper prepared by U.S. health officials from the Centers for Disease Control and Prevention, or CDC. It was a preview of a possible pandemic like COVID-19 and what needs to be done to mitigate its impact. On page 18 of the study was this diagram. The y-axis, or the vertical line, shows the daily number of infections. The x-axis, or the horizontal line, refers to the number of days since the first case was detected. The first curve shows a sharp increase in the number of people getting sick in a pandemic when governments don't introduce preventive measures such as quarantines, lockdowns, or social distancing. The peak represents the skyrocketing number of infected people. With a significant number of the population sick or dying from the pandemic, the healthcare system is overwhelmed. As a result, hospitals are unable to care for all the patients. As the virus attacks the majority of the population or kills a significant number, the virus runs out of hosts, so infections also drop significantly. But by then, so much damage has been done. The second curve has a flatter slope. That's the ideal scenario. It shows a more gradual rate of infection over a longer period of time. Health officials say this can only happen if steps are taken to prevent or slow down the spread of a disease. Last February 28th, an American pandemic preparedness trainer tweeted a slightly adjusted version of the graph. To help everyone understand the situation better, Dr. Drew Harris added a dotted line across the graph, which represents the capacity of the healthcare system. With proper intervention, the curve is flattened as the number of infections are kept below the dotted line. The healthcare system is not overwhelmed. All patients are given proper care and more lives are saved. That updated graph went viral on Twitter and is now being used by many people around the world to explain what flatten the curve means.
The reason for flattening the curve is that it buys you time, and time is the most precious commodity that you can have so you can identify those who are sick with the disease.
So yes, we do need to do our part to help flatten the curve by staying home, observing social distancing, and practicing good hygiene. That way, we can stop the spread of the disease, and healthcare systems around the world are better able to manage coronavirus cases. Ria Tanwat Cotrillo, CNN Philippines.